Hello, my name is Emmanuel Ayi. I'm a pediatric resident at the Children's Wisconsin Hospital in Milwaukee, and recently a postdoctoral fellow at the Massachusetts General Hospital in Boston. I'm the lead author of this paper entitled Mental Health of Caregivers of Children with Medical Complexity During COVID-19. Our aim in undertaking this research project was to investigate the relationship between mental health and financial burden among caregivers of children with medical complexities, also known as CMC. To do this, we conducted a cross-sectional survey on the mental health and financial burden of caregivers of CMC from April 2020 to April 2021 during the early phase of COVID-19. Our study sample included 70 caregivers. We analyzed the association between caregiver mental health and caregiver demographics, as well as child characteristics, through bivariate linear regressions. We then used multivariate linear regressions to assess the association between caregiver mental health and caregiver financial burden, adjusting for significant covariates from our bivariate analysis. Our results showed that caregivers reported lower mental health scores, 56.2 compared to 72.6, and higher financial burden scores, 15.5 compared to 10.4, than referenced population means. Standard deviations were 20.2 and 2.2 respectively. We also found that financial burden and child age were significantly associated with caregiver mental health in our bivariate analysis. P-values were 0.003 and 0.2 in each instance. In our multivariate analysis, we discovered with statistical significance that caregivers with increased financial burden also had lower mental health scores. Our conclusions therefore are: 1. Caregivers of children with medical complex conditions experience more mental health symptoms and greater financial burdens than normative samples during COVID-19. And 2. Parents with greater financial burden also tend to have more mental health issues. Based on these conclusions, we recommend that eligibility for financial assistance should also include financial burden as well as income when providing help to families in this population. Also, local and national stakeholders should consider the provision of financial help in their quest to improve mental health of caregivers. Thank you.